persevere. So thank you all again for joining us, and thanks for your patience. Today I want to talk about elections and our next steps as we plan and prepare to ease the restrictions at the appropriate time and get our economy back up and running safely. First, on Wednesday, the General Assembly returned to Richmond for their reconvened session. It was the final day of the most progressive session in history, and I thank all of them for their hard work. Many of their actions on Wednesday were positive, and I'm grateful for all of the actions they supported to give us more tools to address the effects of the pandemic on hardworking Virginians. We now have protections for homeowners and renters who have lost income due to COVID-19 from eviction and foreclosure. We'll establish a COVID-19 relief fund to help small businesses impacted by this public health crisis. We created a work-share program as an important tool to help workers keep their jobs. Nursing homes and long-term care facilities will receive critical funding in the wake of unprecedented challenges. And we will finally increase the minimum wage in our Commonwealth. But they didn't get everything right. One thing they did not do was to act to move the May 5th local elections. Elections are vital to democracy, and so it is the right to vote. Virginians should not have to choose between their ballot and their health. The last thing that we want in Virginia is a scene like what we saw when Wisconsin held an election a few weeks ago. People waiting in line for hours, trying to social distance just in order to vote. That's why I recommended moving the May elections to November. I'm grateful to the House of Delegates for supporting that. I am greatly disappointed in the Senate for failing to take this action to protect our fellow Virginians. Today, I have signed an executive order moving the May elections back 2 weeks to May the 19th. That is what the Constitution empowers the governor to do absent General Assembly action. If you plan to vote in that election, I strongly encourage you to vote absentee by mail. And I'll repeat that. I strongly encourage you to vote absentee by mail. For people who do come out, we will make it as safe as possible. We are planning to use some of the volunteers through our Medical Reserve Corps to help election workers and polling places put additional safety measures in place. That will include an adequate supply and proper use of PPE for our poll workers. Now, let's move to our jobs numbers. Last week, more than 82,000 people applied for unemployment benefits in Virginia. That means almost 500,000 Virginians are now unemployed. While this is a large number, the good news is that Virginia has the 10th lowest claims per labor force in our country. On Saturday, we launched the Pandemic Unemployment Assistance Program, which allows independent contractors and gig workers to receive benefits. More than 50,000 Virginians have successfully filed under that program, and they should see benefits by the end of next week. While I understand many people have been frustrated by website difficulties and wait times, Virginia has been one of the most innovative states in ramping up our ability to respond to the sudden large increase in people filing for unemployment. We worked with Microsoft and Virginia Interactive to launch a portal with mobile and texting capabilities, and VEC has been a national leader in working to help Virginians receive these benefits as quickly as possible. Many have already begun receiving their checks. As I said, having 500,000 people unemployed is very unfortunate. And so I want to talk about how we're planning to move Virginia forward. I know everyone is eager to move forward. I know that I am. Yesterday, I extended the ban on elective surgeries through May the 1st, and the closure of DMV offices through May the 11th. I took these steps because while we are working toward a time when we can ease some of these restrictions, we are not there yet. But we are moving in that direction. So today I want to outline how we will determine when we can ease restrictions and our blueprint for what that will look like. We have some slides. With our glitch in the technology, I'm not sure if all of you will be able to see those slides, and especially for the hearing impaired, we will have the words that describe these slides in full detail for you after our presentation. First, I want to talk about where we are today, and then we'll talk about where we're going tomorrow. Since the beginning of this situation, we have taken aggressive action. We closed schools, restricted businesses, and directed people to stay at home. We know that this work and the sacrifices of Virginians are delivering results. Together, we have slowed the spread of this virus. Our hospitals have not been overwhelmed, and according to at least one model, we may have seen our case count peak today. I hope that is true, but we must continue to work to keep counts low. We continue to watch the data. Our daily case numbers are still rising, as you can see from this chart, looking at the blue line on the top. But our growth rate is slowing. We see that our case count was initially doubling every 3 days, but now it is taking 9 days to double. That means the growth rate is slower. And hospitalizations rates remain flat. The yellow line at the top is total beds available. The orange line shows that those hospitalized with COVID-19 remains flat. The good news is that 1,600 patients with COVID-19 in Virginia have been treated successfully and discharged. And our PPE pipeline is flowing. We also have ordered 3 large decontamination systems to deploy across the Commonwealth as needed that can clean masks. We'll keep working to buy PPE and to help businesses figure out how to manufacture it. So we need to keep doing what we're doing, and we need to plan for that next phase. Our metrics for phase 1 are very clear. We need to see the percentage of positive tests and the number of hospitalizations both track downward over 14 days. We need to be sure we have enough capacity in our hospital beds and in our intensive care units. And we need to sustain our PPE supply. We will get back to work by greatly increasing our testing, then tracing the contacts of people who test positive and isolating these individuals, not everyone in Virginia. That is the key to moving forward. I'm going to step aside for just a moment and let Dr. Karen Remley explain how we're going to ramp up testing. Dr. Remley is helping lead our testing task force. Dr. Remley, welcome.
So as we work, I think the most important thing to say first, testing is driven by, in terms of the strategy, the governor and public health leaders behind me decide where we're going to test and how we're going to test. What this is looking at the different steps we need to take. We've moved from step 1 into step 2. Many of you who follow the numbers know that we've done 4,000 tests a day in the last 2 days. And what we're really doing is moving from just testing that priority 1 group, which were healthcare workers and hospitalized people, to expanding to people who are high risk. And that includes people with chronic disease, pregnant women, babies born to mother with COVID, and the uninsured and underinsured. As we do that, we're looking for ways to expand, and a lot of that is working with our clinical communities to make sure they feel comfortable and know how to do the test, and make sure we're testing across the state. And as you can see, as we move to the third group, we continue to look at innovative ways to get testing to different communities, to be able to do large-scale testing and support all of the work of the health department as they do what Governor Northam just described, boxing people in, making sure we understand where that disease is and how we take care of it. And as you can see, these are rough estimates on how we can make this happen. In Group 4, we're really at that point where we're able to do large-scale testing across the state, and that'll include looking at people who are asymptomatic to determine how much disease we really have throughout the Commonwealth. And then we all can't wait until we get to step 5, which is where we have just kind of an ongoing, very small amount of disease that we can pretty quickly be able to identify and to be able to isolate. With that, I'll turn it back over to you, Governor.
Thank you, Karen. I appreciate it. So moving forward, we will maintain this testing and tracing strategy. We will ensure that hospitals, providers, medical volunteers, and frontline workers have the PPE they need to stay safe. And we'll monitor our hospital capacity and use of ventilators, ICU beds, and medical staffing. When we see these metrics I've just outlined, fewer positive cases, more testing and tracing, more PPE, and steady use of hospital beds, then we can move to phase 1 of easing these restrictions. Phase 1 will still have heightened restrictions in place. Social distancing, for example, will continue. Teleworking will be encouraged and will also continue. We will still recommend face coverings in the public. For business to resume, both customers and employees must feel safe. To create our Forward Virginia Blueprint for Phase 1, we have been meeting with stakeholders, local governments, and business leaders. We have put together a small work group of representatives from businesses large and small in every corner of our state. It includes barbershops, theaters, hotels, and campgrounds. We're talking to manufacturers like Volvo Trucks, restaurants like Mama J's right here in Richmond, and entertainment venues like King's Dominion and the Barter Theater. Faith leaders will also be part of our work group. We want them to tell us what is the right way to ease restrictions. What will that look like on the ground? What is practical in real life and what is not? We will use their input as well as input from dozens of Zoom meetings we've had with local government officials, business associations, hospitals, and health associations, and other groups to develop 2 sets of guidance. We'll have overarching rules for our businesses, as well as industry-specific guidance for sectors like restaurants and non-essential retail. This will help make sure that everyone knows the rules of how they must operate when it is safe to do so. As we go forward, we will fill in the details of the Phase 1 blueprint and develop plans for Phases 2 and 3. I am as eager as anyone to move into the time where we can ease some of these restrictions. But we must do so in a safe manner, one that seeks to avoid causing a spike in cases or a surge our hospitals cannot handle. As I've said before, we cannot and will not lift restrictions the way you turn on a light switch. We will do it responsibly and deliberately, and it has to be grounded in data. We will move forward, but in a way that prioritizes public health and creates public confidence. Easing too much too soon could jeopardize public health and consumer confidence. 1 step forward and 2 steps back is no way to move ahead. We will need everyone to continue taking actions to keep themselves and others safe. When you cover your face in public or stay 6 feet away from others, you aren't just protecting yourself. You're protecting other people, and that is the most important part of these efforts. None of us is in this alone. All of our decisions impact other people, other Virginians. I continue to be grateful to our medical professionals, our frontline workers from hospitals to grocery stores, and everyone in Virginia who is staying home and making sacrifices to help us get through this together. As you have heard me say many times, we are in the middle of a health crisis as well as an economic crisis. And as soon as we together can get this health crisis under control, as soon as we can put this health crisis behind us,